Birth control. If you listen to social media long enough, you would think it causes cancer, destroys your fertility, shuts down your brain, poisons your liver, ruins your sex life, and somehow disconnects you from the moon. Meanwhile, millions of women use it every single day safely. So today, let's talk about these myths one by one. Myth 1. Your period on the pill is fake. You would hear things like, it is not a real period. Here is the truth. On the pill, bleeding happens because hormone levels drop during placebo days. In a natural cycle, bleeding happens because progesterone levels drop when pregnancy does not happen. It is the same mechanism. Hormone levels drop, uterine lining sheds and comes out as blood. There is nothing artificial about it. It is hormonally controlled. It is not dangerous. It is not toxic. It is not artificial. Myth 2. Birth control destroys fertility. This one spreads fear beautifully. You hear things like, when you use hormonal contraception, you won't be able to get pregnant when you are ready. Here are the facts. About 80% of women will conceive within 1 year of stopping the pill. That number is the same for women who have never used the pill. What sometimes happens is that birth control was masking an underlying problem. Maybe the woman has polycystic ovarian syndrome, but is not aware because birth control was regulating her periods. What we do is we investigate for the underlying cause. Masking is not the same as causing. It is important we understand this distinction. Myth 3. Birth control causes cancer. This one is dramatic and incomplete. Before we jump in, I had a couple recently. This woman, 8th pregnancy, very complicated. She had to deliver through a cesarean section. After surgery, we cancelled on birth control. We discussed everything from pills, implant, patches, intrauterine devices, barrier methods like condoms, and even tubal ligations. The couple refused. Her husband said birth control caused his mother to have cancer, and there was no changing his mind. Now, it is true that birth control is associated with cancer, but association goes both ways. Hormonal contraception reduces the risk of ovarian cancer, endometrial cancer, and colorectal cancer. That protection can last decades. Then there's a small increase in the diagnosis of breast and cervical cancer during use, but overall lifetime risk is equal or slightly less in users. Half-truths create panic, so it is important you get both sides of this association. Myth 4. You must ovulate every month to be healthy. This hormone balancing narrative is trending. The claim no ovulation equal unhealthy woman is not true. If you are not pregnant, breastfeeding, menopausal or on contraception and you are not ovulating, you should get evaluated. But ovulation is not a sacred monthly ritual required for survival. What is important is stable hormone levels, and hormonal contraception provides controlled estrogen and progesterone levels. There is no evidence that lack of ovulation affects long-term health. Myth 5. Birth control shuts down your brain-ovary connection. Now, hormonal contraception disrupts your brain-ovary communication. That is how it suppresses ovulation to prevent pregnancy. But that disruption is not permanent. Once you stop taking it, the communication resumes. And if your cycles do not come back, we investigate for underlying causes. Again, masking is not the same as causing. The birth control might be masking a problem you don't know you have. So when you stop, you have no cycles and you think birth control is the reason. That is not true. Myth 6. Birth control depletes nutrients and destroys your body. Now, can birth control cause certain nutrient levels to drop? The answer is yes. Is it clinically significant? The answer is no. Is it permanent? The answer is no. And can supplementation fix it? The answer is yes. But if someone convinces you that your hormones are ruined and tries to sell you a detox program, pause, because that is not education, that is marketing. Myth 7. Birth control contains dangerous levels of iron. Most birth control pills contain no iron, and for the ones that do, the iron is only found on placebo tablets. It is standard iron supplementation. It is not excessive, it is not toxic, and it is not dangerous. Sometimes viral posts confuse absorbed iron with dietary iron, and numbers can sound scary until you actually calculate them. Finally, birth control is not evil. It is not magical. It is not poison. It is a tool that for some women is life-changing in a good way, while for some others it is not the right fit. Both are valid, but decisions should come from evidence, balance, context, not fear. And remember the couple I told you about? Their decision didn't come from data. It came from stories, and stories can be very powerful. If you learned something new from this video, please like, share, and consider subscribing to the channel. And until next time, stay healthy and be kind to yourself.